Welcome to Derm-It Trotter, Don't Swear About Skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. Today we have a very special guest, Dr. Mary Alice Mina. She's a Harvard-trained double board-certified dermatologist, dermatologic surgeon, and leading expert on skin health and skin care. She is the host of The Skin Real, a podcast for people looking for real skincare guidance by true skin experts, where she emphasizes a holistic and preventative approach to skin health and aesthetics. With over 15 years of clinical experience, she's an invited speaker on podcasts and at national meetings. She is recognized for artistic eye and surgical skills while helping people feel good in their skin. She is co-owner of Balcom and Mina Derm Surgery in Atlanta, Georgia, where she treats patients with advanced surgical and cosmetic procedures to restore and maintain healthy skin. So Dr. Mina, I just want to welcome you here to the podcast, and I'm excited to talk more with you about, what's hot versus what's hype in skincare, because there's a lot of information out there.
Oh my gosh. Yes. Thank you for that introduction. I'm so excited to be on your podcast. Congratulations on starting this. And the more derms we can have out there giving great information, the better. So excited to be here.
I think, one of the reasons I was interested in doing a podcast, and I think also similar origins for yourself, is just, people are frustrated. There's so much information out there, what's true, what's not, especially with social media, which we're all a part of too now, trying to educate. What do you think of when you talk about, with patients or talk about in terms of skincare, when people are like, what do I pick when I walk into a store? Like, what is your favorite type of things to tell your patients and people to go for that are budget friendly, but actually yield results?
Yeah, I love this question. And I get a lot of surprised looks from patients, friends, family. They all want to know, like, what do you do? What's the secret? What's the secret? And I'll tell them what I do and what I recommend. And they're kind of like, no. Like, it's got to be more complicated than that. But I think as derms, we get this. Like, the best skin comes from simple skincare and consistency. And it's simple, but it's not easy, right? And so you don't need a lot of products to have great skin. Really, there's just a couple key things. I mean, if you're super, super basic, you can get away with a gentle cleanser, a moisturizer, and sunscreen, right? Like, those are like the minimum 3 things that you need. Now, I guess I'm a little fancy, I like a few extras in my, now that I'm in my mid 40s. So I do a vitamin C serum in the morning and a vitamin A cream at night. And that is my routine. And it can be that simple. And I'm pretty pleased with how my skin looks. So I don't find the need to add on extra stuff. But I get I get the feeling that people have, like, but what about this? What about that? Oh, I saw this eye cream. Oh, I'm hearing about this. And they think there's got to be other stuff they should be doing. Like, it's too simple to just do that. But it really can be that simple. And I just wish more people understood that.
So are there any particular products that you tend to push people toward in the space of, looking at a particular vitamin A cream, like if they're wanting to do over the counter versus maybe a prescription version? And also for vitamin C, do you really think, from your perspective, do you recommend really going serum, more concentrated, or something combined with sunscreen?
Yeah. So I'm kind of like, I don't like to do a lot of things, but I like it to have maximum impact. So I like what I'm doing to be quality over quantity. And so I have pretty normal skin or oily skin. So I think if you have normal to oily skin, then go big, right? If you're going to just have a couple ingredients in your skincare regimen, then go for the prescription strength retinoid if you can, and go for the most concentrated vitamin C serum if you can. Now, if you've got very sensitive skin and dry skin, then you may not be able to handle it. But for most people, I think you can. And the reason why people I think have trouble with using maybe a prescription retinoid or a 15% L-ascorbic acid vitamin C serum is that they're also doing a lot of other stuff. They might be exfoliating every night. They might be using, AHA or salicylic acid peels. They might be doing other products as well. And when you do too much, your skin gets irritated. And what in my opinion is better is just keep it super, super simple, but then go for like the maximum actives. That's my perspective. What do you feel about that?
No, I completely agree. I think, for a lot of people, they, get too caught up in trying this or that. And I like to call them skin fanatics, where, they will go into one of those stores where you can buy skincare products and they'll try something. 2 days later, it hasn't worked, whatever they were trying to accomplish. They'll try another thing. And then it just gets compounded where really they're not seeing any results, but a lot of irritation. So I totally agree with you.
Right. And I think if you just kept it really simple and were consistent with it, then you can handle that prescription strength retinoid, and then you're going to get maximum bang for your buck, in my opinion. So I like to do as little as possible, but maximize the results. And so that's what I recommend. But again, if you have super sensitive skin, which there are some people, I don't think it's as many as people think. You talk to with your dermatologist or look for some more over-the-counter retinoids, look for some more sensitive skin vitamin C serums. But in general, I think most people can handle it if they're not doing all that other stuff that's distracting.
So kind of going along with that, I think, when you walk into one of these beauty supply stores or stores dedicated to skincare and other products, you'll see sort of a wide array of cost. You'll find things that you're like, oh, I can pick that up at the local drugstore type cost. And then others are, well over $100 or a few $100s in cost too. Do you really think there's a big difference when you look at, that discrepancy in cost? And are there some products that are really worth that extra investment?
Yeah, well, the big difference is the price point, right? And I'm not a budget dermatologist. I don't think budget and my name really are used synonymously. But I'm about quality and I want maximum results. But here's the thing, like you don't have to spend a lot of money to get those results. Now, I don't think you should be looking for like the cheapest thing around, but if you've been to a drugstore recently, all these skincare products they're expensive. They're not cheap anymore. I mean, like $40 for something. So even the drugstore products, they're not cheap, but I tend to use drugstore products, and it's not because I'm cheap and I don't want to spend money for other things. I just think they work and it's at a great price point and I like them. So why would I spend triple the amount? This whole concept of medical grade skincare, right? Like it's marketing. It doesn't mean anything. The only medical grade skincare is a prescription. Like that's medical grade. Everything else, it's just marketing. And there are some companies that are more expensive and they do have very nice products. And I'm not saying that they're bad, but I feel like if I had the choice between two equally effective products and one is 4 times as expensive and one is not, I'm going to go with the less expensive product, because the way I see it is keep your skincare simple and then save that money for in-office procedures every now and then that really offer a high bang for your buck. So to me, I'd rather save my money for in-office stuff that I know really, really works and not spend $200 on an eye cream serum. Instead, I'm going to spend that $200 on a little Botox around my eyes a couple times a year.
I think
But
it's really, go ahead.
I'd love to get your perspective as a derm.
No, I completely agree. Like one of the big things I tell my patients is accessibility. I mean, you want to be able to get things easily too. Some of the middle grade products, yes, we're making it easier online for the patient that wants that, but you can also get that drugstore, quality online, or you can go in and actually, look at the product, feel like, because it is part of the experience too. And I agree with you, because I think what I like to talk with patients about, at some point, what you're going to get from a cream or topical sort of plateaus, what you don't like about your skin, if it's certain lines or discoloration. Yes, you can get some benefit with certain topicals or creams, and that might take 3 to 6 months to see the benefit they're going to give you immediately. But a lot of the topicals, like you mentioned, a form of retinol or vitamin A cream or vitamin C, that's really the marathon. It's the long haul of you using them over the next 5 and 10 years, the benefits they're going to offer your skin. But for the here and now, after using something like that for a good period of time, maybe I'll tell patients 3 or 6 months, like, yeah, I still don't like these deeper lines, or I still don't like, when I smile, I can see these lines around my eyes, or I don't like this little bit of brown that still just won't go away. And I'm doing everything I can topically. That's when I tell them, okay, Now it's time to probably make that transition from what we're doing topically. You're still going to use that for maintenance and long-term haul for what you might get a benefit from. But let's look at now, like you mentioned, in-office procedures to sort of maximize what you're really trying to improve. Is that something that you think is reasonable to approach
Oh my
patients?
gosh. Yes, absolutely. It's like the basic skincare, the things that we talked about. That's it, to your point. Yeah, I'll say like this vitamin A cream is going to be your nighttime cream for the rest of your life, right? Except when you're pregnant. It can be, that's going to give you the most bang for your buck long term. But then, yes, there's a limit to what these topicals can do. We're aging. There are things that are going on in our bodies, and sometimes you do need truly like something in office to really get those effects that you're not going to get from a cream. So I would just rather save that money, not spend it on topicals, and then use it, invest it later. And yeah, I totally agree with all of that.
So kind of along with that, bridging to it is nicely the talk of in-office procedures. I have patients come in and they're like, I don't know where to start. I don't know if I need, a toxin to help my wrinkles. I don't know if I need a filler, or do I need a chemical peel, or what's this BBL, or, do I need laser? Where do I start? And so how do you approach that with a patient? And secondarily, of those procedures, like which ones do you think are really worth the bang for your buck?
Yeah, so great question. And usually what I'll do is I'll give the patient a mirror and I'll say, well, what bothers you? Because sometimes they're come in, they've just, their best friend had a procedure. And so they're like, well, maybe I should get that. But I want to hear in their own words, like when they look in the mirror, what do they see that bothers them? And yeah, to your point, because it may not be what I see, right? And if it's the lines or the discoloration, or maybe they have acne or rosacea, whatever it is. So I want to hear what, when they look in the mirror, what they see that bothers them. And then I'll give my thoughts on what could best address that. But I also sometimes like to start with just evening out the complexion. To me, like an even canvas and a beautiful clear complexion takes away like so many of these other issues that people see. And I'm all about like looking the best you are at whatever stage you are. We're not going to be able to reverse the clock 20 years, and we really shouldn't want to, but I want to make you look as amazing as you can be at this moment. And I find a lot of times starting with the complexion, evening out any discoloration, um, treating any acne, rosacea, like that is like usually the first step that I'll recommend for most people, unless their complexion's already looking amazing. That's a lot of times I'll start with that because it's just, I don't know if you see this too, but like once their complexion's looking glowing and beautiful, like even a little line here and there, it's like not a big deal because they look so
Exactly.
amazing.
No, I totally agree with you. It's true because I think you hone in on certain details that are pulling their attention. And then once you globally kind of help improve things, you're right. Some of that stuff fades to the background and it's not so important to the patient anymore that, they kind of have a new perspective on how they look and their skincare.
Yeah, and that's why I think seeing like a true skin expert for your skin is so imperative, because you go to a med spa, you go to someone who really isn't looking at you globally as a skin expert, and they're going to just focus on kind of like piecemeal. Okay, now you're worried about these lines. Okay, now you're worried about that wrinkle. Now you're worried about this. And it's sort of like piecemeal treatments or band-aids. And I feel like you sometimes or all the time need to take a step back and like look at the person as a whole. And I think that also helps prevent that sort of alien look that can develop over time when you are just hyper focused at on one little thing that you're trying to treat or whack out or resolve. That take a step back, look at the person as a whole, and then reassess. So again, why I think seeing a dermatologist who can sort of treat you more globally is so important.
So I think too, it's just what you mentioned. It's kind of just looking at the foundation. You're going to buy a house that might be a little bit worn down, maybe a little bit of a fixer upper. But if you don't address the foundation yet, you throw new shutters on or do a little landscaping out here because that's just what you see. It's the eyesore on the outside. I think you're right. That's where things get missed. So if you're really looking at that complexion, the foundational issues, things really do kind of bloom from there. And then you can really focus on, like you said, if there's still something that bothers somebody, or sometimes it just doesn't become an issue anymore. I think that's what's kind of unique about that approach. Really great for patients to have
Yeah.
that approach for them. So when
Yeah.
you think about it, then like when I have people come in and they talk about, certain procedures, or maybe you've seen it on social media, I think the hard part for me is that, there'll be a new trend of a particular procedure that people are doing, or something as simple as even slugging. People come in and they're like, oh, should I be doing this? Or am I hurting my skin if I'm not? So kind of from your viewpoint, maybe in the last few months, have there been some things that people have come in and said, this is what I need to be definitely doing? And you're like, well, let's just pull back. Maybe there's a bit more hype over really truth with that type of procedure or treatment.
Yeah, gosh. I mean, all the time I'm being asked about different trends and I can't keep up. I'm like, oh my gosh, now we're doing this. Like it's too much. So I would just caution anyone listening to take these trends for what they are, right? Like same thing with clothing. You don't have to jump on every trend that's out there. I don't need to get rid of my skinny jeans just because, Vogue is saying they're out, whatever. Like I can still wear them if they look good on me. Same thing with skincare. All these trends, like, first of all, like who's the source? Who's giving you this information? Is it Dr. Trotter on her podcast, or is it a skinfluencer who has a passion for skin but really doesn't know much about it, or a celebrity? And what are they? What's their angle? A lot of people will say, "Oh, this sunscreen's toxic, but buy mine," right? So, what is their angle? Are they trying to get you to buy something from them? So I would just caution people about following these trends if they're truly not from skin experts like dermatologists, because trends come and go. And again, really the secret to beautiful skin is simple and consistent. And if you're bouncing around trying all these trends, then you're not being consistent. And some of these trends, they're not all bad, right? Slugging is something we've been recommending as dermatologists for a long time. It's basically just putting petroleum jelly like Vaseline or Aquaphor on your skin, but you don't need to slug your whole face, right? Like slug your lips, slug your eyelids if they're dry, slug your cuticles, right? So people have just taken it too far. And I find like a lot of times now on social media, the trends are getting more ridiculous than ever to try to grab people's attention. And you just have to be really cautious. So I would say if you're using social media for education, just consider your source, who's giving you that information. And I really try to steer clear of trends like with my, makeup and fashion, as well as with skincare.
I think that's sound advice, because you're right. Trends do come and go, but I think the basic and simple, consistent approach that you mentioned, it stays. And what stays is actually usually what works. So I think reminding patients of that is important. And like you're right, people just rebrand things that we've been recommending. We just should have thought of something more clever, the slugging or something that really could have gotten it out there. But I know for dermatologists that we're a little newer to the social media game. We've got competition. So we'll get some newer, I think, phrases out there to help with that.
Yeah,
And I
exactly.
think,
It's not as like sexy, right? To have
yeah, we gotta
to
have some
say
better
like be
words.
consistent. Be consistent.
Yes, we're boring. We are boring. We can admit to that, maybe.
Yeah, but you know what? Be boring with amazing skin. Like I'll take that.
Well, I know we talked about, kind of that skincare regimen. We've talked about, kind of the topical vitamin A creams. If you can do it, go, big or go home. Try to do prescription strength, with a retinoid. Vitamin C, if you can tolerate it, do that serum. When you talk about sunscreens, what do you tell your patients about? What should you look for on a sunscreen label? Is there really a difference, again, on your, local drugstore branded sunscreen versus some of these sunscreens that are a bit more expensive? How do you counsel them regarding choosing that appropriate sunscreen as a part of that skincare regimen?
No, great question. And we probably answer this similarly, but I say the best sunscreen is one that you use and one that you actually put on. So that's like first and foremost. You don't have to use what I use, and what I use and Dr. Trotter, what you use are probably going to be different, and that's okay. But the main things to look for is you want at least an SPF 30 or higher. That's the minimum. Do not rely on sunscreen in your makeup, because unless you're like pancaking it on for like a stage performance, you're not wearing enough makeup for that. So SPF 30 or higher, and then make sure it says broad spectrum. That means that it's going to cover UVA as well as UVB wavelengths from the sun. So you want it to say that. So as long as it says that, I'm okay with whatever sunscreen you like. Now, sunscreen is very individual. I know that I don't like the feeling of stickiness on my face. I want it to feel really light, and I tend to have oily skin. So I look for things that are made for acne prone skin or have less of a moisturizer in it, a little bit lighter, thinner, versus someone with really dry skin. They're going to want a creamier sunscreen. So we're going to have different preferences. And I'll say just try different things out. For, I guess the one non-drugstore thing I do use is I really like Elta MD's sunscreen. I think they are a great price point, very reasonable. And I really like how it feels on my face. I like their spray. It's mineral based. My kids use it. So I like that, but I also love Neutrogena. I love La Roche-Posay. Sensitive skin, I'm recommending Vanicream. So there's so many good sunscreens out there, but do you need to spend $100 on sunscreen? I don't personally feel that you need to. But if that's the sunscreen that you love and you want to invest in that, then fine, go for it if that gets you to wear sunscreen. But I don't think you need to spend a lot of money on sunscreen, but you do just need to make sure you like how it feels, because if you don't, you're never going to put it on.
I think that's a really good point. It's really patient preference. Like you said, as long as you hit those points of an SPF at least 30 and broad spectrum, it's kind of, just personal, on what works for you. And just like you mentioned too, I think, depending upon different skin types, what blends a little bit better, matches better, men can be, and women too, it can be more particular with certain feel, or if you have a lot more body hair, just to kind of get through those areas. So you're right. I think it is a very personal experience, but great advice. If you just hit those points, you can play around with those things and really find something that works for you. Your dermatologist may even have samples for you to play with. I always tell you, that's the best way to get to know if a sunscreen is going to be your best friend. Will you and your skin get along with that sunscreen? So all great tips.
Yeah. And I also recommend, people will say, well, don't forget to reapply, right? And part of sun protection, sunscreen's just one component. So I'm also a big proponent of wearing hats, because again, I mean, maybe this is like heresy, but I don't love putting stuff on my skin. So
not at all. I totally agree with you. People, one of my friends said, you make a terrible dermatologist. You want to just kind of have 3 or 4 things to apply, and you don't even like putting it on. I said, no, practical, it's human nature too.
Exactly. Yeah. So don't forget a hat. Don't forget some protective clothing. Don't forget to sit in the shade. Like these are all things too, because I'll have, and I'm sure you do too, patients come in, or my staff, and they'll say, oh, I got a sunburn. I had sunscreen on, I promise, but they forgot to reapply. They were out at the lake or on the boat for 8 hours, and they only put it on first thing in the morning. So don't forget to reapply. It's not that it's not working. It's just that you do have to reapply, and then you also have to use other sun protective measures too.
Great point. I think it's unfortunately, it is a little bit of effort to really kind of adhere to sun protection regimen, and it's all human nature. I tell my patients too, I'm as lazy as the next person sometimes. I don't want to stop when I'm out in the water, but you can add those rash guards in. And then of course, don't forget those lips. How many people come in, with sun damage to their lips and potentially skin cancer, that may have to be treated further on in life. Those are great tips to include. As we wrap up in the next, a few minutes we have, one of the things kind of tied along with everything, where we talked about what do we do that's sort of skin directed to treat, whether it's topicals, procedures. One thing people ask a lot about, well, what about, are there important things to look at from standpoint of my diet, or even like supplements or vitamins or other things you may recommend that may be helpful for me to maintain, the youthfulness of my skin or just overall skin health? Are there certain things that you do recommend, or that you feel like, I don't know that the evidence really says that's there to be using those things?
Yeah. So I think there's this whole realm of regenerative medicine that's coming out. And I really think this is like the future, rather than trying to reverse things and stamp things out. Like regenerative medicine seems to be like the next level. And we already have some tools in our armamentarium, things like PRP that you can use for hair growth, or people are injecting it or rubbing it on the face, vampire facials and everything like that. The next level will be exosomes. We're starting to see some topical exosomes come out. And there are some early studies showing that it can be helpful for our skin. And then sort of like the holy grail is stem cells. And we're not there yet. But I really think that that's where we're headed. I also think of biostimulants as sort of a regenerative treatment. And I'm a big fan of biostimulants, which are basically products like Sculptra and Radiesse that help stimulate your own collagen. So I sort of see collagen banking as something that I'm really into now, again, in my mid 40s, because as women, we know when we hit menopause and the first few years afterwards, there's a huge drop in our collagen. So doing everything you can now to really bank that collagen, knowing that it's normal that we are going to have this decline. So what I do is doing biostimulants, wearing sunscreen, right? Sun protection's huge, using my vitamin A cream. I have started doing collagen supplements with my coffee. I think there's some data there. There have been like meta-analyses showing that it can be helpful. I don't think you should like hang your hat on that being the only thing out there, but I do find that there is some data that does show that could be helpful. We're seeing a lot of emphasis on increasing protein for people who are middle age. And as we get older, just making sure we keep that muscle mass, not just for our bones, but for our skin, for our mental health. But I really think we're spending too much time focusing on like the outside things we put on our skin. And we really need to focus on the things we're doing to take care of our body, because that's going to then be reflected in our skin. So don't forget things like your diet, eating a balanced or whole food forward, real food forward diet, right? Mediterranean diet, limiting processed foods and sugars. That's going to really break down your collagen faster. Importance of sleep, minimizing alcohol. Like these are all things that not only help your body, but it'll make your skin look better too. So not to forget all of that as we're talking about things that we actually put on our skin or procedures we can do.
Great points. I mean, I hate to end it there as we're going to be finishing up, with the podcast today, but it's been wonderful to have you on today, Dr. Mina. I think you really have given people a really concise, clear perspective on what's important to maintain their skin health. We'd love to have you back on to continue this conversation further, because as you know, we've only just touched the very tip of kind of what's out there and what we really want our patients to be doing. So thank you so much for coming on today.
Oh, thank you, Dr. Trotter. This was a lot of fun.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.